Welcome back, dear viewers. Healthy skin is more than just appearance. It reflects our overall health, daily habits, and how we care for ourselves over time. Joining us today to discuss skincare, dermatology, and the latest advances in skin health is Alyaa Farouk, a dermatology registrar. Good evening, and thank you for joining us on Hala, Kuwait.
Good evening, and thank you for inviting me to the program, and inshallah it will be a good time.
Inshallah. So we'd like to start things out, of course, by asking how have acne treatments changed compared to just, what are the latest advancements in treatment, basically?
The biggest changes of acne treatment over the last few years have been in targeted treatments, combination formulations, microbiome research, and energy-based devices. First, targeted treatments like androgen receptor blockers, which is beneficial for adult female acne, hormonal acne, or patients who can't tolerate systemic hormonal therapy, because this topical anti-androgen reduces sebum production without the systemic anti-androgen effects. Second, combination formulations like combination of adapaline and benzoyl peroxide, or clindamycin and benzoyl peroxide, or triple combination of clindamycin, adapaline, and benzoyl peroxide increases the efficacy of the treatment and the adherence of the patient to the treatment. Also, combination of short courses of oral antibiotic with benzoyl peroxide will increase the efficacy and the adherence of the patient more than the topical antibiotic therapy. Second بقى اللي هو narrow spectrum oral antibiotics, which target only Cutibacterium acne with little side effect on GIT. Microbiome will also برضو lead to less side effects on GIT. Finally بقى energy-based devices are suitable for patients who can take isotretinoin or have recurrent acne, or prefer energy-based devices. In a nutshell, acne treatment is tailored according to each case. Acne only, or acne with scarring, or acne insensitive skin, taking in consideration that ceramides or barrier support skincare is very important in a skincare of acne.
I see. So, I'm sure a lot of people come across and you see all types of different skin. So how do you determine a patient's skin type before recommending a skincare routine?
I usually use a combination of detailed history of the patient, clinical examination, and objective measures in selected cases when available. First, the detailed history by asking the patients many questions like, how do you feel your face after washing your face? Do you experience any tenderness or irritation of any skincare product? Do you have any associated skin diseases like seborrheic dermatitis or eczema? What's your current skincare routine? How often do you develop acne? Are you pregnant? Are you having any medications like retinoids or hormonal therapy? Second, I clinically examine the face for sebum production, especially on T-zone and the cheeks, to determine the type of the skin. Also for skin spores, texture, elasticity, and any signs of skin barrier impairment. Third, I usually take Fitzpatrick skin type in consideration when designing the skincare routine, and choosing the strength of the peels when used in treatment of acne, or in the laser parameters, setting the laser parameters in the treatment of acne. Putting all together, I can design a skincare routine suitable to the patient.
I see. Now, what are some of the misconceptions, or what are the common skincare mistakes you see patients making?
The most common skincare mistake isn't related to using wrong product. It may be related to using the right product incorrectly, or wrong, or using too many products at once. Like
for example,
using using retinoids, salicylic acid, glycolic acid all at once. It will lead to impairment of the skin barrier, irritation, and redness of the skin.
That's putting all together be harsh on the skin.
Yes. Also, over cleansing. Some people wash their faces many times per day. This leads to irritation and burning of the skin.
Right.
Also, over exfoliation, using scrubs many times per week will lead to irritation and redness also. يعني this is some examples of the wrong use of the skincare products.
Right. So, are expensive skincare products really more effective than affordable ones? Like we always see the more organic, more expensive. Are these more
Not
effective?
necessarily. يعني doesn't predict the effectiveness of the skincare product. The most important factors are the type of the skincare product, its concentration and its stability, and whether it's suitable for the skin type of the patient and his skin concern or not. Once these factors are fulfilled, affordable products can be effective. However, expensive products may provide luxurious advantages like elegant cosmetic feel and texture, which increases the adherence of the patient.
Right.
Elegant packaging, more advanced delivery system, which enhances the penetration of the active ingredients. This may improve the experience of the user, but not necessarily translate into better clinical outcomes compared to affordable products.
Yes.
Yes.
So what ingredients do you think everyone should look for in their skincare products then?
There is not one active ingredient everyone can use, because the skincare routine is designed according to the patient needs and patient concern. However, there are many evidence-based active ingredients that most patients benefit from, like topical sunscreen. Daily application of broad spectrum sunscreen is mandatory.
It's crucial.
Yes. يعني if I would to recommend one skincare routine, skincare product, it will be sunscreen, because it decreases photoaging, decreases pigmentation, and decreases skin cancer. فsunscreen is a must in skincare routine. Second, barrier supportive measurements like ceramides that provides hydration of the skin. Also niacinamides to decrease sebum production and decrease the skin pores appearance. Salicylic acid in oily skin and acne prone skin, because it decreases blackheads and whiteheads and decreases sebum production. Retinoids is mandatory for photoaging. It must be applied every day at night to prevent photoaging.
So you touched on sunscreen, and I'd like to ask you about sunscreen. How important is it in preventing skin aging and skin cancer? God forbid.
Sunscreen is the most effective measurement against skin cancer and photoaging and pigmentation, because 80 to 90% of facial aging is attributed to chronic ultraviolet exposure, more than natural aging. That's why topical application of sunscreen can preserve collagen and elastin, slowing the signs of photoaging. Second, sunscreen is a primary risk, sun exposure is a primary risk factor for skin cancer. That's why topical application of sunscreen, especially in patients liable to skin cancer, will decrease the risk of skin cancer. Also in dark skin patients, topical application of sunscreen decreases the risk of post-inflammatory hyperpigmentation. Sunscreen is mandatory in patients after cosmetic procedure like peeling, fractional laser, dermapen, because they support wound healing and decrease the risk of post-inflammatory hyperpigmentation.
That's very fascinating. Well, Alyaa, I would like to pause there as we have a transition here. Would like to show our dear viewers this report that we have prepared. So, dear viewers, let's watch it together, and we'll be right back. Stay tuned. Welcome back, dear viewers. If you're just tuning in, you're watching Hala Kuwait on KTV2, the family channel. And I'm pleased to be joined once again with our distinguished guest in the studio, Ms. Alyaa Farouk, a dermatology registrar. Now, we'd like to go to the next question. Does diet really have a significant impact on acne and overall skincare, please?
Yes, for sure. Diet has a significant effect on acne and overall skin health. First, there are some foods that increases acne formation, like high glycemic food, such as sugary beverages, pastries, and white bread. Also, ultra-processed foods increase inflammation. Dairy products, especially skimmed milk, in some individuals can increase acne. However, this relationship varies from person to person. Also, there are some food that decreases acne formation, like omega-3, like salmon, sardines, walnuts, and flax seeds. They decrease inflammation and acne. Also, low glycemic food like fruits and vegetables. Regarding good nutrition, good nutrition is a must for overall skin health because it provides nutrients for skin repair and structure, like proteins for collagen production, vitamin C for collagen production, vitamin E as antioxidant, vitamin A for cell turnover, omega-3 for controlling sebum production and maintaining the skin barrier. I usually I recommend drinking enough water, have a balanced diet for overall skin health and for treating acne.
Right. Now, I'd like to transition to hyperpigmentation.
Yes.
What are the most effective treatments for hyperpigmentation and acne scars?
Hyperpigmentation acne scars are most common conditions in clinical dermatology. However, they require different treatment approaches. I usually see the patient is having also only acne scars or pigmentation, or both, as they often coexist. Hyperpigmentation can be treated by many lines, but first, topical application of broad spectrum sunscreen daily is a must to prevent recurrence. Okay. Second, topical creams containing evidence-based active ingredients like hydroquinone, tranexamic acid, vitamin C, and retinoids can be beneficial in treatment of hyperpigmentation. And this topical treatment must be maintained for 2 to 3 months to have the best result. Third, chemical peels can be done in some cases and must be chosen carefully, especially in dark-skinned patients, to prevent the risk of post-inflammatory hyperpigmentation. Finally, laser devices can be used in selected cases like Q-switched lasers, picosecond lasers, and fractional laser, especially in patients having both acne scars and hyperpigmentation at the same time.
Okay, yeah.
Regarding treatment of acne scars, there are 2 types of acne scars: atrophic scars and hypertrophic scars. Atrophic scars can be treated by microneedling sessions, radiofrequency, fractional laser in selected cases. Hypertrophic scars can be treated by intralesional corticosteroid, silicone gel or sheets, and laser therapy in selected cases. Every case is examined carefully, and I initiate the appropriate treatment plan to each case.
So what are the most common causes of hair loss, and when should someone seek medical advice?
Hair loss is the most common reason patients seek medical advice in clinical dermatology. Excessive hair shedding, more than 5 to 100 hairs per day for 2 to 3 months, is considered excessive hair loss. Excessive hair loss and the persistent hair loss must be evaluated carefully to determine the underlying cause and initiate the appropriate medical treatment.
Yes.
However, hair loss has many causes. It may be androgenetic alopecia, telogen effluvium, scalp disorders, hormonal disorders, especially thyroid gland disorders, nutritional deficiencies, especially iron and vitamin D deficiency, and also wrong hair care practices like excessive heating or frequent chemical treatments and bleaching.
You said heating?
Yes, excessive heating of the hair.
So maybe our heat here in Kuwait, maybe does that have an effect?
Yes, yes.
Yeah?
It's a combination of many factors.
Right.
Hair loss doesn't have only one factor. Usually it's a combination of many factors.
Which non-surgical cosmetic procedures are currently the most popular, and why?
Botox. Botox is the most commonly performed non-surgical cosmetic procedure worldwide because it's a quick clinic approach with minimal downtime, natural looking results with low risk profile compared to surgery, and visible outcomes within few days. It's also used to treat excessive sweating, to treat dynamic wrinkles, prevent deeper lines formation. On the second, skin boosters.
Skin boosters.
Yes,
What do
become
they
very
do?
popular. because they improve skin quality without significant changes in the facial features, making them attractive to patients seeking subtle rejuvenation. Also, microneedling sessions like dermapen microneedling, radiofrequency are rapid clinic approach, minimal downtime. They are suitable for all skin types and improve skin quality and texture. Lastly, hyaluronic acid fillers, only hyaluronic acid fillers with minimal amounts to produce natural looking outcomes. The main advantage of hyaluronic acid fillers is they are reversible if needed.
Right.
That's why they are popular. Okay, and low risk profile compared to surgery.
Low risk profile.
Yes.
So we touched on some of the factors. What skin conditions are most common in Kuwait, and what factors contribute to those conditions?
Kuwait's hot weather, intense ultraviolet radiation,
Yes.
make the pattern of skin diseases different in dermatology clinics. For example, melasma and hyperpigmentation are very common, especially in women, due to the strong ultraviolet exposure. Also, fungal infections due to hot weather and excessive sweating. Rosacea is very common in Kuwait due to hot weather also. And finally, eczema and atopy due to low humidity and continuous air conditioning. That's why this prevalent in Kuwait.
I see. Now, the biggest topic in the world is AI.
Yes.
So, how do you see artificial intelligence changing the field of dermatology in the future, Alyaa?
For sure, will transform dermatology in the future, not by replacing physicians, but by augmenting clinical making decision. I think the future of dermatology will combine the expertise of physicians and AI-empowered tools for early diagnosis of skin diseases, early initiation of the treatment plans, early screening of skin cancer, facial analysis, and the treatment planning for injectables, and predicting the static outcomes. I think it will help in clinical making decision, augmenting the clinical making decision, and making the appropriate treatment for each case.
That sounds remarkable.
Yes.
Well, it was a fascinating meeting. Of course, we do thank you for stopping by, even for a short time, and sharing your insight, Alyaa. Thank you for joining us on Hala Kuwait.
Thank you for inviting me to this program, and it was a pleasant time with you.
It was our pleasure, of course. Well, dear viewers, that concludes the interview with Ms. Alyaa Farouk, a dermatology registrar. Now we move on to this report that we have prepared. Stay tuned for that and much more.